IIH. I know you guys know what these are, but just in case there are clinicians that are listening that are here to learn and don't treat this commonly, IIH is basically a buildup of pressure, intracranial pressure. And because you have intracranial pressure that's built up, it's going to present with signs and symptoms of intracranial pressure, such as a headache. Usually that headache is in a pulsatile fashion, like it was in this case that we just presented. And usually people can also have nausea and vomiting, dizziness, and it can even affect vision. Now, the most common sign that we see clinically is papilledema, okay? So I'll talk about the difference between the symptoms and the signs. So obviously the signs as clinicians, what we look for, the symptoms are going to be what your patient feels. And headache is going to be the most common symptom. And this could remain even after you have relief of the high intracranial pressure.